Hello, guys. Good morning. Good morning, everybody. Good morning, good morning, good morning. Welcome again. So, we are back today, guys. We are going to be talking about sleep apnea today. And thank you for those joining on YouTube. That was really quick. Those on Instagram and Facebook, thank you for joining. I've not got anyone joined yet on TikTok, but hopefully, folks will join very soon. So guys, we're gonna dive in. Just 1 minute. I'm trying to fix TikTok. Hello, thanks for joining. I appreciate you. It's not been easy. Hello. Thanks for joining, guys. Thank you, thank you. I didn't believe I was gonna be live today. I've got lots of things to do, but I've just made out time to just be online for an hour. I've got to do lots of videos today. I need to do editing. I've got to go to work and I've got training as well today. Poor me. Oh my God. And my exams are coming up. So it's not been easy for me, honestly, but I'm just trying to see how I can juggle all the times together. So I'm going to be talking about sleep apnea, guys. Okay. Today. So for those of you that aren't sure what sleep apnea simply means deprivation of sleep. So, hi, those on TikTok. Thanks for joining. I appreciate you. Okay. So, and for those on TikTok, we are talking about sleep apnea, and I said it's a repeated sleep apnea is a repeated oxygen deprivation. All right. So, if you got your question, just put them in the comment section. So I know a lot of you will be wondering, why have we chosen to talk about this topic? Yes, we chose this topic today because it's a topic that we lots of us need to make our colleagues aware what is going on, and not just what is going on, to see how we can support one another. Okay, it's not been easy for everybody. I know it's not been easy for everybody. Time wise, it's not been easy for everybody. Okie dokie. So, hi, that's my camera working on TikTok now. So, guys, thank you so much for joining. It's been amazing. It's been amazing having you here. I love you so much. Honestly, you have no idea. Hello, 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 hello. You have unlocked. Oh, that's good. So thanks for joining, guys. So today we are going to be talking about sleep apnea. Now, so it's going to be an interactive section where we need to relax and ask ourselves the question: what is sleep apnea? So for those of you that are wondering, thank you. For those of you that say your background is beautiful, oh, thank you so much. I really appreciate that. I appreciate all the stars as well. Please do well to try to donate stars for us. That's how we can be able to bring more valuable content to you. So, like I said, in this channel 2026, we're going to be talking more about different health diagnoses and how we can help one another to keep fit in this year. So, hi, thank you for those that are saying I've lost weight. Thank you so much. Yes, so you can't be talking about advocating for weight loss and why you yourself you're not losing weight. So you need to set as an example. Okay. So thank you so much. I really appreciate all you've done for me. So now let's start, but without wasting our time, we're gonna just dive right in. So what is sleep apnea is the question I want to ask everybody here. What is sleep apnea? So if you're not sure what that is, just feel free, just put them in the comment section here, and we're gonna see how we can talk together. So I'm just adjusting my background here. So yeah. So hello, hi. Salvation Outcomes Friend is also follows his live. Hello. Hi for joining. Thanks for joining my live, guys. So I don't know. I don't. So that's fine. So today we are going to be talking about sleep apnea, guys. So now, what is sleep apnea? In this section, we're going to be talking about the consequences, the causes, and the treatment for sleep apnea, and what is actually sleep apnea. So if you're out there, you've not got your pen and paper, try and get your pen and paper, because this is a section, it's an interactive section that is really going to help you. And so now, let me ask you something simple. Have you ever woken up tired? That's the question I want to ask you guys. So, have you ever woken up tired, even after a full night's sleep? So, a lot of us will say yes, and that's true. The reason I ask this question is because not some might say not. I stayed up too late, tired. Some people might say not. I had a stressful week. That's why I'm tired. But a deep, heavy exhaustion, the kind that sleep doesn't seem to fix. So that is what we're talking about today. So now let me ask another question, if you guys don't mind. The question I want to ask now. Hi, Lucy. Thanks for joining. Auntie Tracy. Thanks for joining. Ovi. Sorry, I can't pronounce your name, guys, but thanks for joining. So, guys, so today we are talking about sleep apnea. For those on TikTok, we are talking about sleep apnea. So we're going to be talking about what sleep apnea is, what are the causes of sleep apnea, and how we can remedy sleep apnea. So the reason I'm facing this side of the camera is because I've got my YouTube here, Facebook and Instagram on this side, and I've got TikTok on this side. So TikTok on this side here. So I have to be more central. That's why engage your viewers by sharing your live, and invite more friends. Engage your viewers to share your live. Okay. Hi, Peaceful. Thanks for joining my live. So we are talking about sleep apnea. Now, I want to ask another question now, if you don't mind me asking. Somebody just came in and just went out again. Anyway, so the second question I want to ask you is, what if I told you that while you were asleep, your body stopped breathing, not once, not twice, but dozens of times every hour? A lot of people will argue with me that that's not true. So basically, when you're sleeping, you do not know if you're actually breathing or not. You don't know until you are conscious. When you're awake, that's when you know. So somebody watching you can easily tell you that when you're sleeping, there are in between your sleep that you actually don't breathe. So for those that are joining and just moving out, well, it's okay, or it's fine, or don't be rude about it. So it's just someone watching you can actually tell. And what if I told you your brain knew it, knew that your breathing stopped at interval, your heart felt it, your blood vessels suffered from it while you were not breathing? So these are what we call sleep apnea, but you never remember all this. Hi, Mohammed Bello. Thanks for patronizing me, sharing my videos, watching, commenting. I really love you so much, Bello. Okay, thank you so much. Thank you so much. Good morning. Good morning, ST. Good morning. Hi, ST. Good morning. Asa, Asa P. Hi, thanks for joining. So, guys, we are talking about sleep apnea. So, sleep apnea is not just for people that are obese. Okay. Hi, for those that are saying I've lost weight, thank you so much. Yes, it's a new journey for me. Okay. I'm a strong advocate for weight loss, so that is why I need to set myself as an example. So if you're watching me, I've actually lost weight, but not to the size I really want, but I really want to really go beyond this level. So I've got my target as 70 kilogram. That's how I want to get to. So at the moment now, I've lost 10 kilogram in less than 4 weeks. So I'm still getting there. When I get to 70, I will do the before and after photograph and send over to yourselves. So guys, in this video, quickly before we start, I'm going to show you how we use Libra sensor. Okay, so for those of you that are not sure about how we use Libra sensor, towards the end of this video, because of TikTok, I'm going to show you how we use Libra sensor to check your sugar level. Yes, so for those that are not able to use their finger to prick to check their sugar level, if you feel that is sore, I'm going to quickly show you how we use Libra to check your sugar level. So I'm going to get one of the stuff here that my husband uses. So these are his stuff here. So I've got here a Libra sensor here, a Libra 2. So it's okay to use. So these are my so I'm going to quickly show you how it's used. So first of all, before you use a Libra is being used to check your sugar level. So if you're the type that is so scared about checking your sugar level like every morning, it's very important you don't have to be diabetic, like I said, before you check your sugar level. Like I've said it in my previous video, you do not have to be diabetic before you check your sugar level. But some people, they wake up in the morning, they feel very dizzy, and sometimes some of us, we are in the habit of rushing out of the house because we're rushing to work. We don't eat, and by 11 o'clock, because of how busy the world is, you're already exhausted. So that is why it's very important to check your sugar level. And the quickest way, you need to discuss this with your GP, because it's not something you buy over the pharmacy anyway. You have to discuss with your GP that if you are having trouble trying to check your sugar prick, speak to your GP. Your GP will prescribe one of these for you, and it's called the Libra 2. So how we use this Libra 2 here, this is Libra 2 here. So I'm going to open it. So you check the expiry date here. You can see that it's still in date here, so you can actually use it. Then you open it. Once you open the Libra 2 here, so you have this compartment here and this compartment. Okay, look at how it looks like. So when you open the Libra 2, this is what you see in the Libra 2, and you use this to pierce, put in your upper arm. It depends on where, but I prefer the upper arm here. So it's easy for you to check your sugar level, and it's got a meter as well. So the good thing with this Libra 2 is actually you can download it on your mobile. So what you do, you get your mobile phone here. Say, for example, this is my mobile phone here. I scan this barcode here. I just install Libra 2. Once you install Libra 2, automatically it guides you through the process to be able to link it up with this Libra. So guys, for those that are joining us just now, hi, Bello is on TikTok. Hi, Bello. You are on Facebook and TikTok. Thank you for joining. So, hi. Thank you for the love. Thank you so much. I love you so much, guys. Like, I love you so much, guys. Oh. So I love you so much, guys. So I'll show you how to use the Libra 2 quickly, and I'll do a video about the Libra 2. So we have, this is Libra 2 Plus. Okay, guys, Libra 2 Plus. So when you open this here, you open it like this. So I've got the serial number here as well. So when you open it, this is what the inside looks like. Then this one here is, can see that it's sealed. So you need to twist it like this. It opens as well. So look at it here. So basically what you're doing, you put this, make sure before you do all these things, whether you're doing it in the house or not, you must put your gloves on. Like I said, infection control, you wash your hands, put your PPE on, and you put your gloves on, okay? So because I'm doing it in the, just for a training, I'm not doing it on somebody, okay? Just a training, that's why I'm not wearing gloves. But remember, when you're doing this in the world or for yourself or for anybody in your household, you need to be putting on your gloves, okay? So I've opened the Libra. These two comes in the Libra packet here. I've opened this. I've opened this one as well. So what you need to do, take this bait that has this purple bait here, put it inside here, and twist it. Once you twist it gently, see, it has fit in, okay? But Bara Ogo, hi, thanks for joining. So it's fitting. So all you need to do, once you put it inside, you bring it out. So basically, the why you put it inside there is to get the needle out. Then you come over here, and you get sterile wipe here. I've got sterile wipe here. So I've literally got everything. Honestly, I've got everything to be able to check your health. So the basic things you need to do to be able to keep yourself up to date is by making sure you have everything that has to do with your sugar level and your vital signs as well. Make sure you get everything. So I've also got what I call the sterile wipe here. Then I've got the Clinidam film. So I'll tell you what these are for, and then I've checked the expiry date for the Clinidam is in date, and then the wipe as well. You open the wipe. So I want to install the Libra. So you come here, you take your hands up, you use the wipe to clean your body in just the same format that you clean your skin when you want to do your venipuncture. Okay, the same hash. Okay, so that's all cleaned. Then I've got the Libra here, so I've just put All right, so that's the Libra. I've inserted the Libra. Okay, guys. So that's the Libra here. So you use this to check your sugar level, guys. So there is no harm. You don't have to be, but your GP will have to prescribe it before you be able to use it. Else you can use that. So what I do is I use the Clean It Down here. I've just opened the Clean It Down. When you open it, this comes out. It's a transparent film that you use to be able to just put over here, and that's it. So once you put it over here, you can open it. You can take the this bit here out. So automatically, so that is my film. So I've just, all right. So I've installed the Libra here, guys. So I've installed the Libra, guys. Okay, can you see? I've installed the Libra. All right. So when you've installed the Libra, all you need to do is to make sure you have your phone set up. You've got your phone set up, guys, to be able to check your sugar level. But because I'm not diabetic, I'm using this as a sample to show to you guys. So I will just take it off after this, okay? So that is the Libra here that I've just installed, guys. So you just need to use your phone here, download the Libra 2 app, and you just check your sugar level. But remember, before you get this installed, your GP will have to prescribe this for you. This one is just a training section, guys, to be able to show you how. A lot of people are asking me how do they use it. I know there are a lot of videos out there on YouTube that are quite confusing, so I've just demonstrated how to use the Libra 2 sensor, guys. So this is how to use it. And then if you've got any questions, feel free DM me. For those that are asking me how to use the DEFCON sensor, how to install it and how to scan it, I'll do that video next week, and I'll post it online. Okay, so if you want to remove the Libra, so all you need to do is to remove the Clean film here. So you just come here, you just click it, remove the film. Okay, so that's the film removed. Then you now put this by the side here and just take it off, and that's it. You've taken out. Okay, so I've just removed it as well. All right, so you are not this is just for demonstration, guys. So and I hope that this does make sense. For those that are still wondering how to install it, I hope this video does make sense. Feel free, ask any question you want to ask. So like I said, make sure you get this prescribed by your GP. If you are struggling to get your finger prick to check your sugar level, but make sure you check your sugar level all the time, because sometimes you're feeling dizzy, don't know why you're dizzy. It could be your sugar level is very low. Like I said to you, I've done the video last week. I talked about the baseline. So anything that is 3.9 below is hypoglycemia. So that is why it's very, very important. The last thing you want is you going into shock or having one kind of sudden stroke. You don't want that. So that is why it's very, very important to keep fit. You watch your weight, very, very important. You remain stress-free. Stress-free 2026 should be your logo and your caption. Okay, so all this goes in the bin. I will bin that later on. So that is how to use it. Okay, so don't get it mixed up. It's a very straightforward technique, and then you don't need any complications there. It's just for your own good. Make sure you check your sugar level all the time. Very, very important. It's very, very, very important. Okay, very, very important. So that is just it, and then I will crack on with my video, guys. So for today's video, for those that thanks for your support, thanks for the stars, guys, I really appreciate. So now let's go back to base. Okay, so I've got other stuff here that you need to have in the house, but I will keep that for next video. Okay, so today we are talking about sleep apnea, guys. What is sleep apnea? If I tell you I've got a pharmacy in my house, you won't believe it. I've got like literally everything I need. So that's why I say I don't even go to the GP. I don't feel unwell. I watch myself thoroughly and watch every members of my house. So we go to the GP when it's really, really necessary. So we are not wasting the GP time. So there are a lot of things you can do at home by yourself, and then make sure you keep yourself fit and your family members fit, and then you go to see the GP when it's duly necessary. All right. So having said that, we are going to continue on what we call the sleep apnea. That's our topic for today. So now, what is sleep apnea? Interrupted sleep. Um, that's what some people will say, but it's a condition so common, so underrated, and so dangerous that millions of people have it and don't know it. You don't know you have sleep apnea because obviously when you're sleeping, you really don't know what is happening. But people watching you will know. So that is why we have what we call sleep study. In every medical parastatals, they have a unit called the sleep study. So if you are struggling with sleep apnea, you go there and they do a sleep study on you and be able to tell you, yes, it's true, or tell you the outcome and how best to help you. So, guys, having said that, let's dive in to the topic for today, which is sleep apnea. So, like I said, today I'm not going to talk about sleep like it's a luxury. I'm going to talk about sleep as it's a life support. So when I mean life support, I'm really really certain about that. So now, sleep apnea is a disorder where breathing repeatedly stops or becomes dangerously shallow during sleep. So that is why I say if you have a sleep disorder or sleep apnea, you are not going to know. People watching you will know, and then people watching you or your health sleep study personnel or your people watching you in the health care sector or in the clinic or in the hospital, they will know because they watch you when you're sleeping. So you literally do not know. And a lot of people see snoring as normal, and that is why sleeping disorder and sleep apnea is being underrated, but it's actually dangerous because these are is a step for you to be able to pick up certain clues and see how best you can support yourself at the early stage rather than leaving it when it's complicated. So now, but this definition I've just told you is incomplete. I remember I said sleep apnea is a disorder where breathing repeatedly stops or becomes dangerously shallow during sleep. This definition, it's very very shallow, okay, and it's incomplete. So sleep apnea is not just about snoring. Remember, sleep apnea is not poor sleep quality. Okay, well done. You've just gained. Oh, thank you for the stars, guys. Those on TikTok, I really appreciate you guys. Honestly, thank you so much. I appreciate everybody for watching my video. So, sleep apnea is not being tired. Remember, so sleep apnea is a repeated oxygen deprivation. So when you stop breathing, when you're sleeping and for a few seconds you stop breathing, obviously oxygen is not sent stars to TikTok universe. So thank you for the stars, guys. So when you're sleeping, sleep apnea is repeated oxygen deprivation. So when you're sleeping and you stop to breathe at interval, so every time breathing stops, oxygen level drops instantly, carbon dioxide rises instantly. The brain senses danger. Remember, you're sleeping. And also the nervous system goes into fight or flight mood. Okay? You know what I mean by fight or flight mood. So, and also the stress hormones flood the body. So this all these things happen once you stop breathing for just a second. So you can imagine if you stop breathing for like a minute, that means your whole body is just gonna like literally struggling. So that is why I said when you're sleeping, you really don't know that you have sleep apnea. So that is why if you're a parent, it's very, very important when your kids are sleeping, you go and watch them. Although me naturally, I'm a spot on mom. When I mean spot on mom, I don't mind whether you're 16 years old or you're 1 year old. I treat you as my child. You are my child. That's why I see you. I don't look at your age that say, oh, you are 16, you can manage. You can't manage nothing. You can manage, yeah, which is good. But I go to my kids' bedroom, I watch them. I stand a few seconds to see how they breathe when they are sleeping. So you can do that as well. So you should be in a better situation or position to raise concern. When your kids are sleeping, you stand, you watch child A, child B, child C, D. Watch them for like 2 minutes as they are sleeping. If they're not breathing normally, you repeat it again a different date. If that is becoming a concern, you can report that to the GP. Then they can get that reviewed. Or better still, send the child to sleep study. So that is how to monitor all these things in children. Because obviously, even you as an adult, you wouldn't know except your partner or your somebody watching you tells you. So it's very, very important. Your body is not resting. Remember, you said you're sleeping, but if you're sleeping and you stop breathing at interval, your body is definitely not resting. So now what happens here is 5 times an hour could be mild. So in an hour, if you stop breathing 5 times, it's classed as mild. Then if in an hour you stop breathing for like 15 times, it is classed as moderate. So that's why I said this class, you need to get a pen and paper ready. So we have what you call the inhalation and the exhalation. Okay, so these are the things you're watching out when you're watching somebody, if somebody is actually breathing or not. Don't forget snoring. Somebody snoring, don't count that as normal breathing. Just try to ignore that. Go for the actual this thing, inhalation and exhalation. You're looking at the breathing symptoms that you're looking for. Just actually go for that. Then if you stop breathing while you're sleeping up to 30 to 60 or even up to 100 times, that is extremely severe. So that is why you find some people, they were okay, they went to bed, the next morning you find them dead. So it is extremely severe. So that is why looking at sleep apnea as something that is very simple, it's not simple. The reason why apnea is undiagnosed mostly is because people mistaking it for snoring, and people see snoring as a normal thing. Snoring simply means obstruction in when you're breathing. So if, like for me, if you're definitely lying backward, you will definitely snore. But if you notice that you're snoring and you try to lie sideways, if your airways are patent, definitely you will not be snoring. So there's a mild obstruction. That is why you're snoring. So that is the reason why you need to, even your sleeping position goes a long way. For me, I go as far as even my cats, when they sleep, I try to see how I can comfortably reposition them in a way that they sleep right. When I mean sleep right, you see a child sleeping like this, you leave that child to the morning. That child will have what we call a stiff neck by the morning. So that's why when some kids wake up in the morning, they tell mom, my neck is sore. That's because as a parent, you have failed. Not really you have failed, maybe you're not aware that when your kids are sleeping, they sleep randomly. Sometimes their hands goes like this. You need to bring those hands out and try to keep them in recovery position as best as you can without obstructing their sleep. When you do all these things, you find out that the child will wake up fully energized, no pain, and at the same time you are helping the child as well. Okay, so you are minimizing hospital visits, because there are a lot of things we parents can actually do in the house for our kids, and it goes a long way to reduce hospital visits. So very, very important. Now, types of sleep apnea. I've told you about the moderate, the mild, and the severe. So when you're sleeping and you stop breathing for up to 5 times, it is mild. Okay, I wouldn't be worrying about that. All I can do is to keep watching and then make sure you keep your airways patent as best as you could. Try to minimize sleeping on your back, because that will increase the risk of you snoring all through the night. Then also try to keep yourself on recovery, sleeping on both sides. So if you stop breathing up to 15 times, that is mild. I'll be raising concern, but at the same time, it's not severe. But if it's up to 30 to 60 to 100 times that you stop breathing through the night, that is severe. You need medical intervention straight away. So like I said, I'm a strong advocate for homely remedy. The reason why I said homely remedy, a lot of things that you go out there to see the GP, you can actually do it in the house. You don't have infection, fine. If you have infection, you need to see a GP to get antibiotic prescribed. But there are a lot of things that you can literally do in the house. You have constipation, you've not moved your bowels for 7 days. I will do a quick video today about constipation. That I've got my list of videos to do today. So constipation is one of them. Sleep apnea is still one of them anyway. So why am I saying this? I'm saying because you've not moved your bowels for 7 days. You've got abdominal pain in your lower abdomen. So you need to ask yourself this question. I've actually literally not moved my bowels. So what can I take to move my bowels? Because obviously you can't PRO yourself. But then you already know that your tummy is distended. You are uncomfortable. You have got pain. So why don't you, as a homely remedy for, treat the constipation in the house rather than going running to the GP? So you can literally take, if you're not allergic to prune juice is really, really good. If you're not allergic to certain fruits, there are fruits that you can take that will soften your bowels, and then it will come out as a type 4. Then you can just move your bowels. Once you move your bowel, that pain will disappear. Then you do not need to see a doctor. So that's why I am a strong advocate for homely remedy in 2026. So you can see how you can literally help yourself in the house, do a lot of things for yourself health wise. That stops you create awareness for yourself, for people in your home, educate them as well. Even hand hygiene, you teach your children how to do proper hand hygiene. It goes a long way to minimize infection. Okay. The most common means of infection, spread of germs, is through the hands. Okay, so that's why hand hygiene is very, very important, because literally we shake people, we touch food, we do this, we do quite a lot of things with our hands. So that is why we can literally transmit infection to with our hands, without even any other thing, just with the hands. So that is why hand hygiene is very, very important. So these are basic things you can introduce in your home. Teach people, your children, how to wash, follow the 12 steps of washing hands, and make sure they keep the environment clean. Some people stay in a very, very, very untidy environment. Their toilet is so messy. You see, nobody is saying everybody should have the same cleaning standard, but hygiene is hygiene. So if you keep a proper hygiene, it goes a long way to also help you manage your health as well. So having said that, let's go back to what we call the different types of sleep apnea. So we have the obstructive sleep apnea. What do I mean by obstructive sleep apnea? That simply means the airways collapses or becomes blocked. So that is why I said, for me, I do not sleep on my back. I only sleep on my back for a short period of time. I do not. I can't tell you I don't snore. I do snore, because my kids have told me, "Oh, mom, sometimes you snore." Yes. So it's normal. Just like I've said, we all commonize snoring as normal, but it shouldn't be normal. So now, the obstructive sleep apnea is the total that simply means the airways collapses or becomes blocked. This is most common form, because it causes relaxed throat muscles and tongue falling backward, narrow airways anatomy, and nasal obstruction. So this is the most common form I've just mentioned. Okay. The causes, like I said, includes when you have nasal obstruction, like you have blocked nose, okay, then narrow airways anatomy. So your airways naturally is narrow, or your tongue falling backward. That is, all this is happening when you're sleeping. And also we have what we call the central sleep apnea. What do I mean by the central sleep apnea? The central sleep apnea simply means, this one surprises people. I don't know why, because every seminar I've been, when I talk about this, people like they keep rolling their eyes. I don't know why people roll their eyes, whether they are surprised or not. So the airways is open for the central sleep apnea. Your airways is open, but the brain fails to send the signal to breathe. So you can see how tricky this one is. Your airways is actually patent. Okay, your airways is patent. Okay, but your brain fails to send signal for you to breathe. So this is often linked to stroke. If you've had one of your past medical history, a stroke, or a heart failure, or neurological diseases, or you've got opioid excesses of opioid. Okay, so this happens when the brain forgets or fail to send signal to breathe, despite the fact that your airways is patent. So that this one can be very tricky as well, very, very tricky. So that is why you need to watch. If you've got family relatives, or you've got patients you're looking after that have got stroke, heart diseases, neurological diseases, and excessive use or over long use of opioids, you need to watch them closely, because this one is what I call, describe as a central sleep apnea. So you really need to watch them. When you notice that in your elderly parents as well, all you simply need to do, don't go and frighten them. Just tap them. Mom, are you okay? Or dad, are you okay? Just tap them. If they're sleeping on their back, you can just slightly roll them in a recovery position without waking them up. Once you roll them automatically, the body, everything will just ignite, and definitely they will breathe. Then you keep them on that recovery position, and they will continue their sleep. You don't need to obstruct or this. Some people, when you wake them up from their sleep, they don't sleep like me. Once somebody knocks on the door, I don't sleep anymore. My phone rings. That's why my phone is always on silence. Always 24 hours, my phone is on silence. So when I miss a call, I go back and call the person. But then, if I get a missed call, I can call you back. But if you call me when I'm sleeping, I pick that call. I won't be able to sleep. So I prioritize my sleep because my sleep time, my rest time is not something I joke with. I joke with because I'm a strong advocate of stress free and pain management. So I try as best as I can to remain pain free, comfortable, and stress free. So that is it. Then we have what we call the complex sleep apnea. For the complex sleep apnea, if you got a pen and paper, please write this down. This one also surprises people, but then it's a combination of both. What I mean both, most people only hear about obstruction sleep apnea, but the brain's role is just as important as every other thing. So the complex one comprises of the brain not giving signal despite the fact that your airways is patent, and also when there's an obstruction in your breathing. Okay, so the next section I'm going to go to why sleep apnea is so often missed. A lot of people, like I said at the start of the video, a lot of people think sleep apnea is normal because, oh, I snore. Oh, that's normal. It's not all the time, so I can't be bothered. You have to be bothered. Why? Because it's not normal to just, once you close your eyes, you're snoring. Once you close your eyes, you're snoring. Every sleep, to the point that people cannot sleep in the same bedroom with you. When you're in this bedroom, people will just leave the bedroom for you to just sleep because you're always snoring, disturbing people's sleep. It is not normal. So that is why sleep apnea is invisible. When I mean it's invisible, you're not seeing it because you're the one that is affected. But people around you can tell you. So that's why when you're snoring, people around will tell you you're snoring. You'll be admit snore. Oh God, I don't snore. You do snore. You do. I'm somebody that will tell you I don't snore. But when my kids told me, Mom, you do, I believe them because these are kids that are well brought up. They are very truthful. They are very honest. So once they say something, I believe it. Okay. So if they say to you that you are snoring, you are really really snoring. So it's not life threatening. Please don't get yourself unnecessarily bothered. But then take action. All right. So now, why sleep apnea is always missed? Why is it missed? A lot of people will be wondering why is it that it's missed? Yes, sleep apnea is invisible. That's the first thing you need to understand. And then sleep apnea, you are unconscious when you're sleeping. So when it happens, you're unconscious. You don't feel pain. You don't remember that you're not breathing while you're sleeping. So instead, you feel tired. You can imagine you sleeping for 12 hours, you wake up still tired. So that means that is an indication that actually you slept, but you didn't sleep. You know what I mean? You were sleeping the whole 12 hours, but if they count in between times, how many times you've stopped breathing in between that sleep, that you've not had proper sleep, is maybe you slept literally for about 4 hours. So the rest 7 hours were just disturbed sleep. So that is why it's not the long number of hours you spend in bed that equates to how many hours you slept. When they say quality sleep, that quality sleep is uninterrupted sleep for that period of time. That is what we call quality sleep. So, but when you're in your bed, you're having sleep apnea, you're snoring, that is not quality sleep. Okay, you've not had good sleep. So that is why you wake up. So how do you know that you have sleep apnea? You have had a long hour sleep, you wake up, you're feeling tired, you're feeling foggy, irritable, unmotivated, you don't feel like going to work. You just remember one bad day that you had at work and just use that to summarize your morning and say, oh, I wish I would not go back to that work. You are anxious, you're depressed, you're not happy. Even you're going to work, you're just being grumpy going to work. So these are the signs that will tell you, symptoms that will tell you that you are probably having sleep apnea, although you don't know the complexity of the sleep apnea, the stage. But then when you go for sleep study, if you let your GP know that you feel you're sleeping for longer hours, but you actually wake up with all these symptoms, and then with all these symptoms, you are of the opinion that you are actually not having quality sleep, your GPs are really, really good in their job. They will refer you to sleep study. There's no harm in going to sleep study, get it done and dusted, and at the end the result comes back positive that you are okay or negative that you're not, but it's better you get it done and you know your status. Okay. So now, some people say I'm just stressed, I'm getting older, I need more coffee. No, that's not true. You are having sleep apnea, undiagnosed sleep apnea. That's what you're having. And that is why you need to seek medical help as soon as you can. Okay. Don't just take things for granted. Having said that, I want to talk about what are the causes of sleep apnea. If you have a pen and paper, please write this down. It's going to really help you. Write this down, please. So one of the causes of sleep apnea is small jaw. A lot of people will argue this with me, but research has proven it beyond doubt. So everything I have told you here is evidence based. Okay, so you can research it yourself and it's exactly the same. When you are reading it and somebody has done the research and bringing it to your awareness, you understand more when somebody is telling you as an interactive section than you sitting down to read it to comprehend it. So that is why a lot of people gain in this my section. Some of them message me probably say, "Oh, that session was great." And so having said that, guys, I will encourage everybody to make sure, listen, pay attention to your health. So one of the I've got a content creation class at 12 o'clock, guys. So I will be rounding up very soon because I've got videos to do. I've got not just videos to do. Yeah, I've got videos to do. I've got editing to do today, and I've got content creation class for 12 o'clock. I need to set up the system as well, and I need to go for a night shift. I need to go for a shift at some point. So having said that, guys, now, one of the causes of sleep apnea, I'm going to break it down into 4 different sections. So, if you've got a pen and paper, write it down. The first section will be the anatomical causes. And then I'll talk about the psychological causes of sleep apnea. I'll talk about the lifestyle contributors of sleep apnea. The lifestyle bit is very, very important. So, you need to listen to the lifestyle bit of sleep apnea, please. So, the lifestyle bit of sleep apnea is very, very important. Why do I say it's very, very important? It's very, very important because it is a lifestyle that you have created for yourself that is causing you to have sleep apnea. So you can literally wait until I get to that section, get this information, and stop those bad habits and have normal breathing, normal quality of life. Having said that, I also talk about the medical conditions for sleep apnea, which you might already know. So, so I'll start with the anatomical causes of sleep apnea. One is small jaw. So the one of the anatomical causes of sleep apnea is small jaw. For people that have got very narrow small jaw, so those are the people that sleep apnea can mostly affect. Then crowded teeth. If your dentations are crowded, you can actually have sleep apnea from that as well. Okay. And also, if you have thick neck, there are some people that their neck is quite thick. Okay. The surroundings of their neck is quite thick. It's mostly for people that like are quite big. So they have the tendency of having sleep apnea as well. Okay. So having said that, we also have the narrow nasal passage. When you're in your nose here, your nasal passage is quite narrow. If it's narrow, remember we are breathing through our nose. So if your nasal passage is quite narrow, there is possibility that you'll be having sleep apnea. So, having said that, we will go on to talk about the psychological causes of sleep apnea. So, one of the psychological causes of sleep apnea is muscle relaxation during sleep. When your muscle is relaxing, so that is why when you're in the house, like me, I advocate when you're in the house, you try to make your home as comfortable as possible. When I mean comfortable, if I do not have a job, I'm on annual leave, I can literally be in my house for a week. I will not make a phone call to anybody. Because everything I need is in my house. Like I've got gym in my house. I've got everything I need in my house. I've got everything as regards homely remedy. So I literally don't need anything. If I want to watch a cinema, I want to watch a movie, I can literally watch it in my house. Convert my study room to a mini theater. And so you make your life so comfortable. in the sense that people are not literally seeing you outside. You're just like, you're literally indoor and you're comfortable. Everything that you can go to the shops and get. If you want to eat any takeaway, once in a while, spoil yourself, you can literally order it. If you want to do your gym, you can do it at the house. So there are a lot of benefits of relaxation. So that's why I said the psychological causes of sleep apnea could be are muscle relaxation during sleep, and then poor airways muscles tone. Okay. And another one is unstable breathing control. So that is why, like me, I'm a strong advocate. If I'm sleeping, I sleep on both sides, left and right. I sleep on my back only for shorter period of time. Some people sleep on their back all night. I don't know how comfortable that is, but some people do that. And then you find majority of the people that snore, that sleep on their back, they snore quite a lot. So why don't you just make a lifestyle change as well and try to see how you can reposition yourself on both ways and see how that helps. Having said that, we have what we call the lifestyle contributors of hi Francis Lucky. Thanks for joining my live. I appreciate you. Okay. So, having said that, we have what we call the lifestyle contributors, okay, of sleep apnea. So, these are basically things that you have caused by yourself. What do I mean by you have caused by yourself? Say, for example, alcohol, especially before bed. You take alcohol and before bed. Some people take the alcohol for in their mind. They say, "Oh, I want to remain high," but you've just taken alcohol and you've gone to bed. So definitely you are trying to promote sleep apnea. You will not be comfortable. You might still you're, oh, I'm drunk. No, you are not. So these are the things. And also sedation, sedative medication. Some people sedate themselves, and sedatives. They take medications to make them sleep, and then they feel they are doing that on a good note. That may be their intention, but actually that can cause sleep apnea because that sleep is not natural. You are forcing yourself to sleep. Then also we have what we call smoking. I'm not saying you should quit smoking and drinking. That's not what this section is all about. But I am just telling you the lifestyle contributing factors to sleep apnea. So for you to minimize snoring, sleep apnea, the causes are what I'm just listing out for you, and that is what you need to look into. Is this something that you can see how you can change your lifestyle? So smoking is another thing that increases sleep apnea. Also, sleep position, back sleeping. Back sleeping, sleeping on your back promotes sleep apnea. So that is why it's very important when you're sleeping, try to make sure your airways is patent. Try to sleep on both sides, left and right. You sleep on your back and you can tilt yourself this way out a little bit. But then sleeping on your back up like all night, you're promoting sleep apnea, and that is not what you need. For those that are joining us just now, we are talking about sleep apnea. What is sleep apnea? Sleep apnea is the obstruction, breathing obstruction, and oxygen deprivation in the body at interval when you're sleeping. So we don't want that to happen, because when you stop breathing, your brain stops working, your body goes into fight and flight mood, and there are a lot of your a lot of things, your hormonal, there's a lot of hormonal stress hormone floods your system. So there are a whole lot of things that happens once you stop breathing for just a second. So that is why we are trying to make sure we bring awareness to everybody out there that sleep apnea is being underrated, but actually needs to be rated really, really above high. The reason being that we need this to be able to get to as many people as possible. Can they share the video so others can benefit as well and look after their health? Very, very important. We also sleeping on your back is good, but then please don't make it a habit sleeping on your back all the time. We also have the medical condition for sleep apnea. So for me, I use my life as a case study in all these diagnoses. So one of the reasons why I left accounting and went into health is hi. Hi, Dr. Abel. Bring them to video. I would have, but I think you're hi, Emeka. Thanks for joining. I will bring you guys on video next time. Thanks for your information and awareness to the society. Thank you so much, Dr. Abel. I love you so much. Thank you. So now the medical causes of sleep apnea simply means for those that are beg obesity. So obesity, but not always. Remember, not all everybody that is obese that go through sleep apnea. Okay, I've told you about the other psychological bit, that people that are on unstable breathing. I've talked about the anatomical bit, people with very round neck. So these are the things, and then we also have hypothyroidism. Okay, so for people that thyroids, okay, thyroidism simply means, of course, thyroid. So hypo, you know what that means. So these are the people that also suffer from what I call sleep apnea as well. We also have the ovarian syndromes. So people suffering from polycystic ovarian syndrome. So these people also have what we call, I'm not going to go into, I'm doing a different video about that as well. So those people have what we call sleep apnea, and then not all of them. And some people that are diabetic, don't get it wrong, not everybody that is diabetic have sleep apnea. And then people that got heart failure as well can basically have what we call sleep apnea. So one thing you need to do is, you do not have to be overweight to have sleep apnea. You can be as skinny as possible to have sleep apnea. So that is why I said not all obese people have sleep apnea. Remember, there are other multiple factors from all the four sections I've talked about here. I've talked about the anatomical causes of sleep apnea. I've talked about the psychological causes of sleep apnea. I've talked about the medical cause of sleep apnea, and I've talked about the lifestyle contributors of sleep apnea, causes of sleep apnea. So whatever category you fall into, you need to take action as soon as you can. Hi, thanks for joining. I love you. Thanks for the stars. Oh my God, this is amazing. Honestly, I didn't want to do this video today because I've got lots of things to do. But thank you for the stars. I really appreciate it, honestly. Thank you for the stars, guys. We need your stars to be able to keep bringing more videos to you. We really appreciate you guys. Thank you. So now, what sleep apnea does to the body, you need to know. So for those of you that are snoring and denying that, oh, I'm not snoring, that's not true. You are snoring. Okay, accept it. When somebody tells you you're snoring, say, really? Am I snoring? How long? Investigate, dig deep. How long am I snoring? Was I breathing the whole time? Don't just argue to say, oh, that's not true, I'm not snoring. You are snoring. Just accept it and dig deep. Ask more questions. So when I sleep, how do I sleep? Do I sleep on my back? Do I sleep on my side? Am I snoring really deep? Is it continuous? Is it like a intermittent? Is it do I stop breathing in between sleep? How do you observe me? Can you observe me next time? And or can you do a video when you see me doing this? And so give people that confidence rather than arguing to say I don't snore. Give people job to do so that they can get that feedback for you. You analyze, look at the feedback. Anything you know, you can show that to your GP. Then before you know, your GP can be more curious as well, send you for sleep study. Then more things will come out from the sleep study. So don't be afraid to go and do a random check on yourself. Excellent presentation. Thank you so much. I really appreciate. Thank you so much. Your comment means the world to me. God bless you. Okay. So having said that, what sleep apnea does to the body? One, I'll talk about the heart and the brain, because once your brain stops working, your heart stops working, that is you gone. So that is why I said we have the 9 pulses in human body. And the last pulse in human body is the carotid pulse. So that is why when somebody dies, I am going to do a death verification. Like I said, I'll get a mannequin so we can be demonstrating all this in the house so you can understand what it means. When somebody dies, I am going to do a death verification. The first thing I do, I check the carotid pulse. I'll follow the 5 steps of death verification, confirmation of death. I know that. So if somebody dies and I'm going to verify the death, I must make sure I check the carotid pulse, because that is the last pulse in human body that shuts down. So if that pulse is still there, then that person hasn't died. Other pulse may shut down, but the carotid pulse is the last pulse in human body to shut down. So that is when you know, when that pulse is absent, then that person has died. Then you look at the other 4 steps as well. Then you can confirm the person to have died. Then you prepare your paperwork that you hereby verify that so and so person has died. So having said that, I will start. Well, what are the causes of apnea? What does the sleep apnea does to the body? One, the heart. I'll talk about the heart. I'll break it down into the heart, the brain, mental health, and metabolism. Stay tuned and watch to the mental health bit and see how you can help yourself. So for the heart, chronic high blood pressure. So your if you're having sleep apnea, you have the tendency of having what we call the chronic high blood pressure. Chronic simply means prolonged period of time. It's continuous. It's not acute. That is just a one-off. No, it's prolonged. That's why we call chronic high blood pressure. Irregular heart rhythm. So those people, they get sent for ECG every now and then because their heart rhythm is irregular. So, and also we have what we call the heart attack. You can literally have heart attack if you have a complex sleep apnea. And also you can have heart failure as well. So that is why some people, when you really need to check your health. In summary, that is the heart I've talked about. So if you are having what sleep apnea does to the body is what I've just told you. So this is just the heart alone. I've told you you have chronic high blood pressure, you have irregular heart rhythms, you have heart attack, and you have heart failure. Then we go over to the brain. What does sleep apnea does to the brain? So if you're out there still snoring and then you are denying or arguing that you're not snoring, accept it and seek help. Lie on both sides. Stop lying on your back, please. If you want to lie on your back, it's fine, but for a short period of time, be in that habit of lying on both sides, on this side and on the, if it's not going to be comfortable initially, but you get used to it. So the brain, you can literally have memory loss. You're sleeping all the time, you're sleeping on your back, you are having sleep apnea, you're not helping yourself to make any lifestyle changes that can help you. You will begin to develop memory loss, poor concentration, stroke, or risk of dementia for the future. So these are the things that the brain, what sleep apnea does to the brain. And that is not what you want for you that is in your 30s, in your 40s, or in your 20s. You don't want that. So also the mental health bit. What sleep apnea does to the body, number one, for the mental health is depression, anxiety, emotional instability, fear of the unknown, okay, sadness, undiagnosed ADHD, okay, undiagnosed ADHD, okay, you are super everywhere, okay, super active everywhere, emotional instability, fear of the unknown, you're sad, anxiety, depression, not happy. So these are the mental health effects when you're having sleep apnea. Then we also have the metabolism, the very, very important. For the metabolism bit of sleep apnea is insulin resistance. So that is why when your GP, so see, to study medicine is very, very easy. If you're there still struggling, if your child is there struggling what to do, studying medicine or any nursing, any of health related courses are really, really good, because you see, one diagnosis that you have can give rise to other multiple diagnoses because they are all changed. Say for example, somebody that is obese, you have sleep apnea, you been to sleep study and it shows that you have high blood pressure. So you alone discovering that you have sleep apnea, been to sleep study, done multiple tests, you've been diagnosed one. Physically, you already know you're obese. So they use that as a baseline to do your assessment as well. Then you come back, you have high blood pressure, that is two. You have insulin resistance, you have weight obesity to deal with. So just in less than 2 minutes, I've mentioned 5 health diagnoses that one can experience for just being overweight. So so if you're there, you're overweight, you don't want to go for checkup, and you feel all is well, all is not well. If you leave it till very late, or if you're not watching your diet intake, what you eat, what you drink, and try to be very strict. As you see me, I've got very beautiful soup called fresh fish soup. I love it so much, but I just can't eat it because I have to strictly keep to my diet plan. So that is just it. I will only eat it at the right, when I want to eat it at the right time. I can't just wake up and go and eat it now. No. So you really need to be very disciplined. as in very, very disciplined, because obesity can actually can lead to risk of diabetes, risk of insulin resistance. Already you're obese, that is diagnosis number one. It can lead to insulin resistance, that is two. You can lead to diabetes, that's three. It can lead to high blood pressure, that is four. Then it can lead to sleep apnea, maybe central sleep apnea, that is five. So just you having five diagnoses, how are you going to cope? That there's no quality of life in that. So, and all these four, five can disappear. Four can disappear when you lose weight. So why won't I do everything possible to lose weight? Because once I lose weight, and remember, when you're overweight, it affects your kidney and your liver as well. So that is the reason why losing weight and keeping fit is extremely important. It's a game changer, it's a life changer. So if you're out there still struggling, don't know what to do, please, losing weight will bring your liver and your kidney functions back to normal. Get rid of your sleep apnea. If you lie on both sides and you lose weight, you can get rid of your high blood pressure as well, because that one is caused by insulin resistance and your weight. So you get free, and at the end of the day, you get your life back. That is what everybody wants. So the metabolism bit of it is insulin resistance. Yeah, I'll need to do this verification on TikTok. Inactively dictated. Sorry, I'm just going to quickly do verification on TikTok, guys. So I think that's it now. I'm back on TikTok. Hi, guys. I need to do quick verification. After 1 hour, I think on TikTok, you have to do a verification. Thanks for joining, guys. I really appreciate your support. So now we have the metabolism bit of what sleep apnea can cause to the human body. So the metabolism bit simply means insulin resistance, and then weight gain, and the difficulty losing weight despite going on your gym, dieting, and all that. You have difficulty losing weight. So that is why if you're above the age of 18, you can speak to your GP that you are having difficulty losing weight. Definitely your weight will affect so many organs in your body. It will affect your BMI. It will affect there are so many things. So I showed you guys, because of TikTok, I really can't bring it. I've got an equipment I will show you just now, that it tells you everything that has to do with your human body. I've got it on my phone here. I'm using the phone for Facebook here, so I really can't download it. I can't show you my screen, but it tells you your progress. If you're losing weight, it tells you your progress. What I mean by it tells you your progress, TikTok doesn't like anything advert, but I'm just going to quickly bring the equipment and show you. Hello, guys. So that's the equipment here, and then it's called the Smart Scale 2. So, like I told you, I've got everything in this house. I've seen everything. You won't believe it. The only thing I don't have is ECG equipment. I don't have a CT scanner, but then I've got everything, literally everything to keep you fit. So I've got this here, and then this one, basically, you can see the name here. It's called the Smart Scale P2 Pro. Smart Scale P2 Pro. So when you open it here, it tells you what it checks your weight, it checks your BMI, checks your water low, checks how many calories you have in your body, and so many more. So I don't even know how. I'm just struggling to open this. Can you imagine? Look at me, like showing people, and I can't even open. Okay. So when you open it, guys, this is how it looks like here. So that's what it looks like. So you literally, so you can see EUFY, that's what it's called. So it's a smart scale P2 Pro. So if you look at it here, it tells you your BMI, it tells you your water low, it tells you everything that you need to know. All you need to do is just to put your weight. It tells you your weight as well. All you need to do, you just put, when you're setting it up with your name, your date of birth, your everything, you just include your height. For me, I'm not tall. I'm 163 centimeter. So I put that. Then automatically it records everything. It tells you your cholesterol level as well. your body muscle weight. So it's so good, really, really, really good, honestly. So like I said, I've got gym in my house, I've got this in my house, I've got so many things in the house, so to keep you fit. So that is why you really need to go extra mile, invest in your health. When you invest in your health, you find out that you're looking more fresher, you look more younger, you look more happier, you're not depressed, you're not worried. So let me just give a quick advice before we proceed. So if you're out there walking, spend that money on your, hi Josh, nice to thanks for joining my live, thank you so much. If you're out there working excessive hours, or you're just doing your normal job, my dear, invest that money in yourself and in your children. The reason I said so, I'm not saying you shouldn't send money back home. You do send money back home, please do send money back home, but be sensible. Because if you're not sensible, people out there, people, especially people overseas, they will want you to send money to them. You send money, they will even say thank you to you. They don't even care. None of them will even, when you are, somebody is traveling back home, you send things to them, mobile phones, things, so many things to them. When the same people are coming back, they will not even give them dry fish to come and give to you. They will even give them one Isam or a premium to give to you, because they feel you are there, you have it. People are overseas. It doesn't mean you're overseas means you mean you have everything. No. So that is why you have to be very strict. 2026 is this 2026 for me. I don't reply people. That is what I do. I do not. 2025, I was a victim of scam. I was being scammed terribly. Both family members, both people trying to promote my page, people trying to help me on social media. I got terribly scammed by family members, Korea, so many. So the year ended, even church members got scammed by church members as well. So to 2025, I just let it slide. I had to forgive everybody and cross to this year. But this year, I am so tightened to the point that I don't get myself loose guard anymore. I don't. So try your best to do the same. Set a boundary for yourself and be very, very disciplined, and watch your back, please. Very, very important. So you can actually get one of this skill here. I'm not doing advert for the company, but it's really, really good. It tells you there's a map in there as well. When you go to your profile, I'm using that, else I would have showed you the profile. If you go to your profile, when you install the app on your phone and start to check your weekly weight. So I check my weight weekly. So between last week and this week, I've lost 3 kilograms. So that's how good it is. And then you already know your meal plan. You are eating small portion, and you know what you're eating, more of your veg and your fiber, and your protein. So and mostly all my drinks are protein, mostly on protein diets. So it helps you to lose weight naturally. You're not doing excessive walking. You're not doing going to a gym unnecessarily, but you're losing weight. And at the same time, be mindful when you're losing weight, your collagen level is also going alongside, so you're not, one part of your body is not suffering. So having said that, guys, we are going to go back to the daytime signs people ignore. What are the signs of sleep apnea that people ignore through the day? Number one, waking up unrefreshed. Somebody waking up still telling you I'm tired is a sign, please. Secondly, morning headache. You wake up, you're having light headache. That is a sign. Number three, you wake up in the morning, you have dry mouth, or your lips are all dry. That is a sign. Number four, needing caffeine to function. You need caffeine. You want to take coffee before you function properly. No, that is a sign. Number five, then nodding off unintentionally. You are having a chat with somebody. All of a sudden, you're gone. You're sleeping. Once you're watching TV, all of a sudden, you're sleeping. That is signs of sleep apnea. You're watching TV with someone, all of a sudden you've dozed off, you're sleeping. You're having a chat with somebody, all of a sudden you slept off. That is sign of sleep apnea. Then number two, and the last on the list, is mood swing. Mood swing. You and I know what mood swing is. So you are having a mood swing. That is a sign that you are having not all mood swing, but when it's really repetitive, that is a sign that you're having sleep apnea. So, how sleep apnea is diagnosed? I have told you at the start of the video, sleep studies. So, what do they do in sleep studies? In the lab or in the clinic, they do what they call, I'll just put the name here, polysomnography. Okay. So, the reason why they do that one is to be able to give a rough idea how many hours you sleep in 20, if you're sleeping for like 12 hours, the if you go for sleep study, the equipment is connected to you, and then at the end of the day it tells you. The reason I know this because I've been to sleep study with my daughter, so I do know how it works because I spent the night there with her. So it tells you how the sleep study works. It's say for example you're sleeping for 12 hours or for 10 hours. It extracts the time that you are actually sleeping and not breathing out, and then it gives you the exact amount that you actually slept. So if you sleep for 10 hours, the study might come back to say you actually literally had active sleep for 4 hours. So that is actually low and very, very poor. So that is why sleep study is really. Hi, Lady B. Thanks for joining. I throw a salute. Thank Boza for you. Thank Boza for you. You're a woman of grace, good heart. God will bless you for all your help. So, having said that, sleep apnea. So, how sleep apnea is being diagnosed? Like I said, sleep apnea is being diagnosed one in the lab or in the hospital. In any hospital, we have what we call the sleep medicine unit. So, that is where they'll refer you to and you get your sleep study done. So also home study apnea testing. I've done that as well on my daughter. So the home apnea study testing is they get all the devices delivered to you from the hospital, or when you get the GP will give it to you. You come home, they'll tell you, they'll show you, literally show you how to use it in the hospital or at the GP. Then you bring it home and do it in the house. Then you can actually, if you're doing it on your child, it actually tells the reading is being recorded. Then when you take it back, they extract it. Then they'll now tell you actually you slept for 12 hours, but the active sleep as per the study shows that you actually had 6 hours sleep, so which is below the recommended sleep period of time. So then they will now advise you further. It's very, very simple. Okay, now the key metrics you need to understand about sleep study is apnea hypopnea index. So what, which we call the AHI. What does that mean? I'll put that in the comment section as well. Then oxygen desaturation. So, and then also the frequency as well. So these are the things that they put into consideration, like I said. So that is why you might be sleeping for 12 hours or 11 hours, but actually the oxygen desaturation and the actual sleep that you are having is what they look into. So that is why you can be sleeping for 12 hours, but you are not actually sleeping for that 12 hours. The active sleep could be about 6 hours or 4 hours or 5 hours. The rest are what we class at is not being classed because of your sleep apnea and symptoms that you have, diagnosis that you have. It's not life threatening, but it could be life threatening if you have the complex one. Like I've told you, we have the mild one, we have the central sleep apnea, we have the mild sleep apnea, and we have the severe sleep apnea, where you actually need to go and see a health professional. But for the mild one, you can actually do it by yourself in the house by repositioning yourself. Like my for myself, my daughter have lectured her in a way that whether she's at uni or she's home, she doesn't sleep on her back. She has to sleep on both sides. I even prefer people sleeping face down on this side, facing this way. You're facing down, but sleeping this way, keeping your airways patent rather than sleeping up, because that increases the risk. So we don't want people sleeping and dying in their sleep if you have the complex type. So that can be more fatal. So we don't want those complex types. So that is why we advocate for homely remedy to see how you can help yourself. Now, what are the treatment options for sleep apnea? So for those that are joining us just now, we are talking about sleep apnea, and we said that sleep apnea is the deprivation of oxygen while you are sleeping at interval. And when your oxygen is being deprived, because when you're sleeping, you stop to breathe at interval. So don't take snoring all through the night as breathing, please. You are not. Snoring is also is not classed as breathing. So it's also sign of obstruction of your airways. That is why you're snoring. So there are two different things. Don't get them mixed up. And I've talked about the causes. Now we're talking about the treatment for sleep apnea. What are the options? So we have what we call the CPAP therapy. So the CPAP therapy simply means the gold standard. The gold standard, it delivers continuous airways to keep airways open. So if yours is quite above medium, you can have that. That not a failure, is not weakness. it's a medical device, like glasses for vision. So you use that to help with your breathing, and you're not on it for a long time. Some people are on it for longer time, but then some people are on it for a shorter period of time until they stabilize. And then the good thing about sleep study is, if you go for sleep study, one thing is to another, you do a couple of blood tests as well, and then in the process, you can also get diagnosed that you have hypertension. That gets can prescribe amlodipine or any lower dose of any of the high blood pressure medications. So all these things work alongside. And if you're pre-diabetic as well, they can prescribe you like a metformin as well, 500 milligram for a start. If you are insulin resistant, that can help as well. And if you're obese, they can also talk to you about working on your weight. So the importance of losing weight, because of your liver and your kidney functions, and also your quality of life. So that is why losing weight is a game changer for everybody in 2026. Nobody wants to be obese and walking about with multiple health comorbidities. Nobody really need that. So having talked about the CPAP therapy, which I said is a continuous airflow device that is being attached to you to help you breathe, we also have what we call the oral appliances. So custom dental devices that repositions the jaw and the tongue. So I don't have the device here, like the Libra sensor I've just demonstrated to you guys here. I don't have that device here because those are medical equipment that obviously I won't be able to buy on my own to come and demonstrate. But then, having said that, so these are devices that they position it to yourself in a way that it positions your jaw. It's fitted. Then it has a strap here. It has a strap here as well. Then it has hooked up, and it's a device that is on the like a tube that is from the face mask to the device. Then it's been set, so it positions basically your tongue and your jaw in such a way that it helps you to breathe normally. And then that is also for a short while in some people. Then we have what you call the positional therapy. The positional therapy is what I simply do in the house. The reason I do that is because it is extremely effective. Like I said to you, every life I bring here is evidence-based practice, and I've demonstrated it, and I've researched it as well. So it's clinically proven to be working before I'll bring it online. So that is why I said the positional therapy is what I go for. Reason being, I don't sleep on my back. I sleep on my back for a short period of time. Maybe when I've actually not slept, I'm just lying on my bed. I don't want to sleep straight away. Maybe I want to scroll my phone. Then I go on that. I can stay on my back. But if I actually want to sleep, I just go on both sides. And my body is so used to it that when I lie on my back, I'm uncomfortable. I must go on both ways. And I have trained my kids that way as well. When they are sleeping, I must go back and reposition them from when they were little. So now they are used to that as well. So you hardly find any of my kids sleep on their back. They must either sleep on both sides to keep their airways patent. The last thing you want is somebody going to bed and you wake up in the morning, the person is dead. You don't want that. It's quite scary. But then sleep apnea is something that we all commonize, but then it can be fatal if not looked into properly. Having said that, positional therapy simply means preventing back sleeping for a long period of time. Nugo, I hope you all heard me. And thanks for the stars. Excellent presentation. Oh, thank you so much. I really appreciate Wiki. Thank you. Thank you for joining. Thanks for the stars, guys. I really appreciate. Thank you so much. So now, having said that, we have what we call the weight redistribution. The redistribution. I know this one will shock you, but not just weight loss. Don't forget, fat around the airways matters. Okay, for people that have got like round neck. Okay, people that have got round neck, will understand, or people that have got round neck or base that have been to sleep study will understand what I'm talking about here. So not just about weight loss here, but it's about the fat around the airways that matters. So if you have that big neck here, so it's very, very important you go on that side to side therapy to help yourself breathe properly, please. And when somebody tells you that you are actually snoring when you're sleeping, don't argue with the person. Please, when somebody tells you anything negative that you don't want to hear, it is good practice not to argue. Just go and dig deep. Oh, is it true? Do I snore when I'm sleeping? Yes, you do snore. How do I snore? Do I snore? Oh, thanks for the stars. Thank you so much. Thank you. Thanks for the stars. I really appreciate you. Thank you. God bless you. So if somebody says you are snoring, don't take it as an offense, please. Don't argue or brush off the person to say, oh, I'm not snoring, it's not me, who told you I'm snoring? Don't even argue. Dig deep, do further investigation about that comment. So, am I snoring? How do I snore? Is it interval? Is it intermittent? Is it continuous? Is it loud? What position was I at the time? Was I on my back or on my side? Dig deep. Can you take a video of me when I'm sleeping next time? Give consent. So if it's your family, you're giving consent about sleep apnea, they can literally be honest with you as well. So, hi, Queen. I love you, Queen. I'll call you after now. I love you, Barrister Queen. You're amazing. Thank you so much. So when somebody tells you that, mom, when you sleep you're snoring, please take that very serious. Don't just tell your child, oh, go away, why are you saying I'm not snoring? Don't even argue it. Dig deep. Ask the child or ask your sister or whoever that has told you, or partner, anybody that said you're snoring. Ask the person, do I snore all the time when I'm sleeping? How often do I snore? Is it continuous? Is it intermittent? So, what position was I at the time? Was I on my back? Was I on both sides? How long was I snoring? Was it the whole time I was sleeping, or just for a short period of time? How short period is the time? Is it 1 second or 1 minute? How would you? So get more facts. You write all these things down. Then the next time again, somebody tells you again you're snoring, you take more details. You compare both of them. The third time again, you take more details again. Then you've gathered enough evidence to present to your GP. Like for me, I tell my kid, if you find me snoring, do a video of me. I know it's somehow the videos can be awful. Because you're sleeping this way, or you're sleeping with your mouth open or your legs scattered everywhere. But then dignity, they'll protect dignity anyway. They'll just snore, video just your face to see how you're snoring and maybe your upper. So it's really really good. Don't brush off things, because everybody in this life has one medical diagnosis or the other. So that's why you don't laugh at people. When somebody is diagnosed of one thing or the other, you don't laugh at that person. You are meant to be sympathetically present and support that person with the best you can. Support the person genuinely. So, because everybody will be in that position one day. Just like I said, loss and grief knocks on everybody's door. So if loss and grief is not, please let's share this post. It's very important to all. Oh, thank you so much, Queen. Barrister Queen, I love you so much. Thank you so much for that. So, like I said, loss and grief, I'll do a video today about breaking bad news and loss and grief. So, what to expect in loss and grief, and what to expect when you are going to verify a death, how to present yourself. So, obviously, when you're going to see a patient, you'll be all smiley, you'll be all doing a lot of things. But when you're going to verify a death, you are going into the community to verify death of someone that just passed. Remember, they've got family members, they've got loved ones. This is somebody that family members have lost a beloved one. How you present yourself, how you chat with the family, extra support you provide. And I also make a video about last offices as well. I've done one AI last offices video about palliative care, the difference between palliative care and end of life care. But I will do a live section of last offices. So the things you look out for, and how to effectively close somebody's mouth that have died in a dignified way without keeping the mouth open and keeping the person half haggard. I'll do those videos. I'll do all the editing. Then I'll post them out by Wednesday this week. Okay. So having said that, it is very, very important to support people that are going through one illness or the other, because health issues knocks on every door. So today you are healthy does not mean you're going to be healthy for the next 50 years. No, there will be a day where you'll be down as well too. So that is why it's good to be very, very kind to people. You don't have to literally know people, but you have to be really kind. So having talked about I've talked about the oral appliances. I've talked about the positional therapy on how the treatment for sleep apnea. I've talked about the CPAP therapy that is being done in hospital. And then I've talked about the oral appliances as well, about the jaw and the tongue being positioned properly. I've talked about the positional therapy by not sleeping on your back continuously for a longer period of time. I'll talk about the weight redistribution, not just weight loss, but fat around the airways. So that is why it's very important. If you sleep on this side, you also sleep on this side as well, to keep your airways patent. Sometimes I also sleep, when I sleep like this, I put, when you are doing your BLS, you get told about your airways. You have to put your chin up like this. You have to keep your tilt your head backward, lift your chin up, to keep your airways. All those things work. Even when you're doing your recovery position, you remember when you do your recovery position at the end, you have to tilt the head back as well and put your chin up. So the airways still has to keep kept patent. So it's very, very important your airways are kept patent, regardless whether you're doing your BLS or you're doing your recovery position or you are doing weight redistribution while you are sleeping. Very, very important. So then the last bit, and that's the last resort in treating sleep apnea, is what they call the surgery. For selected anatomical reasons, your GP can tell you, you know what, we are going to do surgery on so and so this, the HAOs. Hi, HA, thanks for joining. Thank you so much for joining. Thank you, sir. Thank you. God bless you. So that's it. No, so what happens when sleep apnea is treated well? What happens when sleep apnea is treated? So one is, once your sleep apnea is treated, you have clearer thinking. Thinking in the sense that you have a full concentration, you have improved mood, you have improved quality of life, you have stable blood pressure, you have better relationship with people and yourself, you have renewed energy. Remember, depression is one of the causes. Depression is one of the things that you suffer when you're going through sleep apnea as well. So, but when you are being treated, you gain all these things back, and then you come back to normal, have a normal quality of life. So, having said that, guys, I'm going to be running off shortly because I've got content creation class for 3 hours class, and I need to do my videos as well. So I'll be wrapping up very soon, guys. So having said that, I will conclude by saying, please, I feel like myself again, and you see some people when they've recovered from sleep apnea, they'll tell you, oh, now I've got myself back. It is not exaggeration. They are being honest. This is energy we are talking about here, oxygen we are talking about here. So if you're able to breathe normally without any assistance, you don't know what God has done for you. So that is why you need to be grateful to God all the time for his infinite mercy, for his support, for even the air that we breathe is so, so amazing. You can imagine every household, you have to buy petrol in your car, you have to buy food before you eat, you have to buy gas before you cook, you have to pay for electricity before you get light. You can imagine if you have to buy the air to breathe. You can imagine how expensive that would be. Some people will just die out of air starvation because you can't afford it. So that is why we need to be very grateful to God Almighty for the air that we are breathing. So conclusively, sleep apnea is not rare, okay? And it's not harmless, okay? Please. But and it is not a character flaw. But one thing you need to consider is sleep apnea is a medical condition. Please remember, sleep apnea is a medical condition. It could be lifestyle indicator that contributor that you have caused, or for medical reasons or psychological reasons. But then, regardless, whatever stages it is, sleep apnea is a medical condition, one that quietly damages the heart and the brain. It damages the heart and the brain. So that is why it's so I take it very serious, because I like to check things, I like to research things, I like to check things, and I like to experiment things, and I like to know why things are I have done a research on why do we actually have cancer? Why does cancer exist? I have done deep and deep research into it, to the point that if there were any reasons why there shouldn't be cancer, I would have known that. So, but unfortunately, it's something that we have to live with. So, having said that, going for random blood tests to check your health status is not out of place. You are doing the right thing. Just keep motivating yourself, keep doing the right thing, and you will be fine. Okay. So now, sleep apnea, like I said, is a medical condition. It's one that quietly damages the heart and the brain. Having said that, while people believe they are resting, or some people believe, oh, he's only snoring, they commonize the snoring as, oh, it's just snoring. Snoring simply means, when somebody snores, it simply means an obstruction somewhere in the airways. That is why you're snoring. Else your breathing should be normal. You should be breathing normally. Okay. So that should be a trigger for you to like investigate more. So the danger isn't sleep apnea itself. The danger is you not knowing that you have sleep apnea, or you, somebody telling you you're snoring, you're waving it off because you don't want to go for any diagnosis that you'll be told you have sleep apnea, or you don't want to spend money, or you don't want to have that fear of you, oh, I've been diagnosed that I have sleep apnea. I would rather be happy to be diagnosed of five multiple health diagnoses and start working my way in coming out of them, than I pretend nothing is wrong with me and keep quiet till when I'm in my 40s or in my 50s or in my 60s or in my 70s. I'll now have multiple comorbidities pressing me down that I don't have any quality of life. I just wish I'm just gone. No. So the earlier I feel, the better. And also understand all these things are not for the elderly. Sleep apnea is not for people, for the elderly or for people that are obese. Anybody can develop sleep apnea. Okay, so that is why the earlier you start, the better you get treated and you get out of it and you continue with a normal lifestyle. Okay, so very, very important. The danger is you not knowing that you have sleep apnea. That is the danger. So sleep apnea itself is not dangerous, but you not believing or accepting or not realizing or not knowing that you have sleep apnea, that makes it dangerous. And once you know, once you recognize it, you have the power to change not just your sleep, but your future. I hope that makes sense. And this will come to the end of our section for today, guys. And I hope you really enjoyed this section. I love you so much, guys, and I will leave it at that. So, for those that just joined us, we are talking about sleep apnea. We've just described sleep apnea as obstruction in oxygen and circulation in the body during sleep. Okay, because you are breathing at interval, you stop when you're stop to breathe at interval where you're sleeping, and you do not know that you have sleep apnea. So that is why we have brought this to your notice for you guys to be able to understand that sleep apnea, it's not your making, it's a medical condition that you need to look into. So if you go by, some people describe sleep apnea as a disorder where breathing repeatedly stops or becomes dangerously shallow during sleep. That definition is also okay, but it's incomplete because you before sleep apnea can be properly defined, sleep apnea it simply means a repeated oxygen deprivation. When oxygen is deprived in your body, oxygen levels drop. So the moment you stop breathing for a second, just for a second, not 1 minute. 1 minute you're already gone. For a second. So you can imagine oxygen levels drop. Your oxygen levels drop. And once you stop breathing for that second that your oxygen level drops, your carbon monoxide goes up instantly. That is not what you want. And why your breathing stops for that 1 second, your brain senses danger. Your nervous system goes into fight and flight mood. And at the same time, your hormone stress floods the body. So your body is just like everywhere in that 1 second that you stop breathing. So how much more when you stop breathing for up to like 60 times in 1 hour? That's a lot. That is severe. So that's why you really need to know if you have sleep apnea. So when next, if you don't take anything home from this section, please take home that when somebody tells you you're snoring, please, please, please don't wave the person off. Try to dig deep, investigate further why you're snoring, how long you've been snoring, and then see how, get more information from that person, then get that repeated up to 2, 3 times, gather evidence, and present that to your GP. Simple as that. So you don't need to do so many remedies. And also, when you're sleeping, avoid sleeping on your back. This is a life game changer. You might not believe it, but try. If you are the type that is snoring, watching this video, experiment it for the next 3 days. Sleep on both sides. Avoid sleeping on your back. Then tell somebody in your house to monitor you, and they'll come back to tell you you are literally not snoring anymore. So yours is mild. And when you're sleeping, make sure your airways is patent, very, very patent. Okay, so in our next section we'll get a mannequin to come and demonstrate quite a lot of things so we can have a feel of what goes on in the human body. All right, Thank you for watching. I love you all, and thanks for staying tuned. Thank you, Bello. I love you so much. Thank you, Francis. Thank you, Barista Queen. Thank you, Lady B. Thank you. So many names to say thank you to. I really, really appreciate 106 people on this live. Thank you so much. God will bless you. I really, really appreciate. I don't take it for granted, and I will see you in my next video. Thank you. Bye. So I'm going to end this YouTube now. I'm going to end Facebook. And I'm going to end Instagram. I'm going to end. Done. I'm going to end this as well. And thank you for joining. Share your reels. I've shared my reels. Here we go. So, and thanks for joining. For those on TikTok, I know you want to stay here forever. I love TikTok. I love TikTok. I love TikTok. Thank you for joining, and see you in my next video. Righteousness, peace, joy in the Holy Ghost. Righteousness, peace, and joy in the Holy Ghost. That's the kingdom of God. Don't you wanna be the power of the kingdom? Don't you wanna be the power of the kingdom? Don't you wanna be the power of the kingdom? Come on, everybody. Welcome again. So we are back today, guys. We are going to be talking about sleep apnea today. And thank you for those joining on YouTube. That was really quick. Those on Instagram and Facebook, thank you for joining. I've not got anyone joined yet on TikTok, but hopefully folks will join very soon. So, guys, we're gonna dive in. Just 1 minute. I'm trying to fix TikTok. Hello, thanks for joining. I appreciate you. It's not been easy. Hello. Thanks for joining, guys. Thank you. I didn't believe I was going to be live today. I've got lots of things to do, but I've just made out time to just be online for an hour. I've got to do lots of videos today. I need to do editing. I've got to go to work, and I've got training as well today for me. Oh my God, and my exams are coming up. So it's not been easy for me, honestly, but I'm just trying to see how I can juggle all the times together. So I'm going to be talking about sleep apnea, guys, okay? Today. So for those of you that aren't sure what sleep apnea is, sleep apnea simply means deprivation of sleep. So hi, those on TikTok, thanks for joining. I appreciate you, okay? So for those on TikTok, we are talking about sleep apnea, and I said sleep apnea is a repeated oxygen deprivation. All right. So if you got your question, just put them in the comment section. So I know a lot of you will be wondering, why have we chosen to talk about this topic? Yes, we chose this topic today because it's a topic that we lots of us need to make our colleagues aware what is going on, and not just what is going on, to see how we can support one another. Okay, it's not been easy for everybody. I know it's not been easy for everybody. Time wise, it's not been easy for everybody. Okie dokie. So hi, that's my camera working on TikTok now. So guys, thank you so much for joining.